find it where
That's
you
what
want.
I'm asking you, that's a specific, so if you could take, even if you take discogenic pain, you take phantom pain syndrome, or whatever pain syndrome, you can categorize that either as a peripheral syndrome, a neuropathic syndrome, or a central pain syndrome, right? Because all those syndromes are mediated either centrally or peripherally.
Indeed, I mean.
So then again, my question to you, are you essentially just asking that any pain syndrome that we encounter, you would like to see medical marijuana be considered as a first-line agent?
I mean, again, nerve-related pain is really where I was trying to go. I mean, I understand that osteoarthritis,
So regional complex pain syndrome,
it's a type of neuropathic pain.
not always. It's not, okay, it's not a proven neuropathic pain syndrome. That's not a proven neuropathic pain syndrome.
Okay, well, I have my pain instructor in the audience here, Dr. Talbot. I have, is it true that there are complex regional pain syndromes are?
Let me just intervene for a second, because Dr. Talbot will be testifying a little bit later. He's been asked to come and provide testimony. So maybe he can address that when he comes up.
So my essential, like I am willing to understand, my main understanding when after I've heard what you're saying as a petition is that really it's all pain syndromes that we encounter. Because you could categorize even myofascial pain syndrome or fibromyalgia as a central type of pain syndrome.
I mean, I'm interested in pain management down the road and specializing, so I don't have all the specialized knowledge, but as far as I understand it, the textbooks that I've read, they do cordon off neuropathic pain with certain specific definitions. You know, the injury to a nerve, it could be a peripheral neuropathy, but I believe that, well, maybe these central pain syndromes wouldn't technically be considered neuropathic pain then. I mean, post-stroke pain and traumatic brain injury related pain, I could be, let me retract that statement. I think technically speaking, neuropathic pain, they do look at injury to nerves. Now, some of these, like your CRPS, can be started by an injury to a nerve, but then it becomes a central pain syndrome. So there are fuzzy distinctions between these different pain syndromes.
Right, so I'm asking you, what are you actually specifically petitioning for in terms of pain?
A neuropathic pain.
And then I'm gonna go back, because you, earlier on in your testimony, and you have to correct me if I'm wrong, but what I'm trying, or someone on board, if they're understanding what I'm understanding, after I hear your testimony, you're putting in central pain, peripheral pain, brachial plexus pain, complex regional pain syndrome as part of those pain syndromes, as that you'd like to see a primary use for cannabinoids. I mean, is that what I'm understanding, or I'm not? If I'm not understanding that, I would like you just to make it very simple and clarify specifically what you would like us to consider.
Well, Dr. Kaur, those definitions were in the paper by the UC Davis group, where Barth Wilsley and his group, which include the president of the American Pain Society, Scott Fishman, they, in their paper, qualified all those conditions as falling under their definition of neuropathic pain. And so my understanding was that, yeah, those would be part of that.
So then you want us to consider
Neuropathic
any
pain.
type of pain that would either be classified as central or peripheral,
Read
which
the
is
letter.
essentially is all pain. Any type of pain that you have, you can either classify as central or peripheral.
I don't believe that osteoarthritic pain, a pain in a joint, or pain due to fascial injury would really, doctors would call that neuropathic pain in our current definitions.
So I'm just gonna, again, there's a couple of articles on fibromyalgia where fibromyalgia is considered multiple nerve entrapments, which would be neuropathic pain, which would then fall also into the case of myofascial pain.
I mean, there are fuzzy definitions for sure in medicine, that sometimes diagnoses aren't clear cut on all the boundaries. I'm sure I could come up with that for.
So I'm just trying to understand, what do you want us to, would you like us to contemplate for your pain?
I think at this point, it's the strong evidence with the studies in the pain journals were on neuropathic pain. And, you know, as a broader issue, if you would like to also take up, I'm not specifically petitioning on that, but I think it might be, in order to adopt the research on neuropathic pain as a relevant pain condition that doesn't have to have failed standard treatments, I think it might it might be incumbent on the panel to rethink the definition of intractable pain, because, and broaden it to just any kind of chronic pain syndrome. So that's sort of my sort of afterthought after writing this petition. Because I want to think about how does this panel actually make a difference for the pain patients, and I do think that the more you can empower the doctor who's treating the pain patient to not have to sort of, at least with neuropathic pain, you can stand on solid footing, that there's this strong evidence base. You might not feel that that strong evidence base is there for myofascial pain or osteoarthritic pain, so that's why I didn't say all pain syndromes. But the paper that I have in the Journal of Opioid Management, we studied 139 chronic pain patients who had a wide range of chronic pain syndromes, including neuropathic pain, myofascial pain, all had benefit from medical cannabis. So, take that with what you will. So,
Okay,
let's hear from the pain experts too. So.
thank you.
Dr. Sunil, please. We might have a few other questions for you.
Just, we use the term intractable pain. Would you give us a sense of what you think is the duration of such a pain syndrome that makes it intractable?
I prefer, I took pain clinic at the University of Washington. We never used the term intractable pain at all in pain discussions. We talk about chronic pain syndromes, and that's generally described as pain lasting 3 months or longer.
3 months.
Yeah, that's my
That's
understanding.
kind of the definition of chronic.
Yeah.